Hi, I'm Terry Kimball with the Chandler Chamber of Commerce, and I am so excited to bring you a brand new member benefit right here. I have Jeff Roberts joining me, and Jeff is with Capstone Care. It's Capstone Health Network, and I am so excited for you to hear about this program. So, Jeff, thank you so much for being here.
Terry, it's my pleasure. We are so pleased to be working with you in the chamber.
So let's start off, and I want you just to tell our members and our businesses here in our community, tell me a little bit about how and why Capstone Health Network was formed.
Well, there's a huge need, no surprise to anybody, for healthcare in the United States. Long before COVID-19 came on the scene, there were massive problems. You have 30 million people who don't have health care. Health insurance is very unaffordable for small businesses. And since 25% of the US workforce has lost their jobs since the first of the year, the situation's only gotten worse. So there's 35, 40 million people that don't have health insurance at this particular time. So I formed Capstone Health Network, excuse me, with 7 physicians, and we are a for-profit, but we're also a social good company. We were formed to make a difference and try to do something to help the members of your chamber and other small businesses around the country to be able to afford quality health coverage.
I know that there are a lot of health insurance plans out there. How is Capstone Care different from a health insurance?
Well, first of all, Terry, we are not health insurance. We were formed to cover the top 75 to 80% of the reasons that most of us all need to go to see physicians. There are major problems, obviously, with health insurance in terms of its cost. And when you think about it, health insurance companies have to go ahead and be able to cover things that 90% of the people will never need. Heart transplants and expensive operations and long hospital stays. So they have to build all that into the cost. And even though the vast majority of us will never need those things, in essence, we are paying for them. So we'll get into the details of the program in just a moment. But what we tried to do is put together a program that would be affordable for small businesses, well, businesses of any size, but it would also deal with the real life needs that most of the people have. So we cover the top 75 to 80% of the reasons most of us and our families need to see doctors, but it's at 1/20th to 1/50th of the cost.
Well, let's talk about that. That's perfect. So tell us about what the Capstone Care program, what does it include?
Well, it's a comprehensive package of healthcare media that will make a difference, I believe. So we have 2 programs. They're both called Capstone Care. There is an entry-level program, which is called Capstone Care Silver. And that includes something that we've been hearing a great deal about of recent time, telemedicine. The CDC, as I know you know, has been heavily pushing the concept of telemedicine as a way to help people avoid catching and spreading COVID-19. So the anchor service that we have is 24/7, 365 telemedicine. That means that the employees of your employers could speak to a board certified physician who's licensed to practice in your state every single hour of every single day. And that means that 4 in the morning on Christmas or Thanksgiving or January 4th, we have a network of 1,100 physicians standing by. So the employee could speak to one of those doctors literally in under 30 minutes. And the good news is they will never get a bill. There are no copays and there are no deductibles. That's the first piece. Second piece is something that there's a major need for as well, which is short-term, no-charge mental health counseling. And this is done by master's level counselors. And then the third element of both of our programs would be discounts on all FDA-approved prescription drugs of up to 80%. The normal discount, though, is more like 15 to 50%. And this is usable at about 67,000 pharmacies nationwide. We have a second program that is very similar. It's also called CapstoneCare. It's called CapstoneCare Premium. And that program includes unlimited telemedicine as much as someone needs it. It also includes the mental health counseling and the discounts on prescription drugs. But it also includes some things that go beyond traditional health insurance. So things like 10 to 50% savings on dental services, everything from cleanings to extractions to just anything you can think of, 10 to 50% off. And that's at 240,000 dentists across the United States, plus 10 to 50% savings on chiropractic, hearing, vision, diabetes supplies. It's just a very long list of healthcare services, but we purposely set this up as a social good company to make it affordable, even for your very smallest employers. And we can get into the cost in just a moment if you'd like.
So what if I'm a company and I already offer health insurance to my employees? Is this a supplemental, or is this in addition, or is this in place of?
Well, it's both. So for example, what we have seen is that the vast majority of smaller employers, certainly most that are under 10 employees and under 20 employees as well, they typically cannot afford health insurance, even though they know that there's lots of benefits by offering it. And so we can either be an option or an alternative to expensive, high deductible health insurance if they don't have anything. Or we can be a supplement, because if I'm an employer and I know that I have to provide health coverage, most of the time I'm going to choose an expensive high deductible plan. And what that means is that the vast majority of people, even though they then would have insurance, it doesn't pay for anything, because only a very small percentage of people actually ever hit their deductible, which means that although someone has insurance, they're basically paying everything out of pocket. So for an additional modest amount of dollars, $17.95 per month, the employer could choose to add our CapstoneCare program, and a lot of those out-of-pocket costs would go away, because again, we don't have doctor bills, we don't have co-pays, we don't have deductibles. And unlike the telemedicine that typically is in most other healthcare programs, we do not charge a per use fee, which is important, because if someone happens to have a family with a bunch of children, they could use this a lot, especially because telemedicine has been gaining in popularity. CDC is heavily advocating using it as a way for people to not catch or not spread the coronavirus. So we can be very flexible depending upon the need of that particular employer.
Wow. So now I can see how the program can help the employer. Are there other ways that it can help the employee? Because retaining employees is a really big deal right now.
Yeah, let's talk about both for just a moment. If I'm a small business, I know, and I work side by side with my employees. I know them, I know their families. I would love to provide health coverage for them, but I can't. Because if I have, just as an example, let's say that someone has 10 employees. Now again, we can help a company with 10,000 employees, but let's say someone has 10 employees. The cost to them to provide classic health care, health insurance, would be $2,000 to $10,000 per month. That's just not sustainable, frankly. But in our case, because we're a social good company and we want to help, someone could cover all 10 of those hypothetical employees for $179 per month, not per employee, but for all the employees in that example. But there's other advantages to both the employer and the employee. So for example, you hit on one of them. If I'm a small company and I can't afford to offer healthcare coverage, it's really hard to hire quality employees in many cases. So in this case, the employer, if they're able to advertise that they offer health coverage, they will see a significant increase in the number of applicants, and they can be much more choosy about the applicants that they hire. And the one that you hit on is very important. Turnover is a major problem in many, many industries, restaurant and retail, et cetera. And part of that is because those companies traditionally do not offer health insurance, there's nothing to anchor that employee to that particular job. And so it's a major factor in this constant revolving door of employees. So if they're able to offer a form of health coverage that's pretty comprehensive and yet at a price the employer can afford, it's going to minimize their turnover. It'll also cut way back on sick days and call-offs, because a lot of times someone is calling off because they have an ill child and they can't see a doctor except during regular business hours, whereas they could have used telemedicine to talk to the doctor or done a video chat with their child before or after work. So there's a lot of benefits for the employer. And then from the perspective of the employee, massive difference, as we just mentioned one of them. So let's say that I'm a single mom or dad, and I have a child with a skin rash or a low-grade fever or pink eye or something. I need to get help for my child, but the only time I can do it is during work hours. So now I have this really difficult choice. Do I take time off work, which is going to cost me money in many cases and inconvenience the employer, or don't I? And so in our case, they don't have to worry about that because they can talk to the doctor in the evening, before work, after hours. So they'll get treated quicker is another advantage. So if on a Saturday morning I don't feel well or I have a sick child and I'm afraid to go to an urgent care because I'm concerned that I might catch coronavirus. So now I've got to wait till Monday to even call the doctor. We've all had the fun experience of being put on hold. We finally get on the phone and they say, I'm sorry, the earliest the doctor can see you is Tuesday. And so I don't even start the process of feeling better. Whereas with our program, someone could call, talk to a physician in generally under 30 minutes. The physicians are able to prescribe non-narcotic medications. So someone gets to the doctor faster. They don't have the risk of going somewhere where there are sick people, and they can get well faster. So there's a lot of benefits to both the employer as well as the employee themselves. Great question.
So you had mentioned earlier, and I want to make sure that I heard it correctly. You said the cost of the program was $17.95 a month. So
Yeah.
let's talk about that cost, because again, I don't have hearing aids, but maybe I need hearing aids. Tell me about that cost, and will our members, will our businesses get a type of discount? So
Yeah, great question. You know, the biggest concern we tend to get is, sounds too good to be true. Well, it's not. This program took years to put together. The elements of the program are used by 5 million people. It's one of the top telemedicine companies in the United States. They're actually the 47th fastest growing company in the United States. That's our partner in that particular area. So remember I said to you that we're a social good company. So one of our formational reasons for being in existence was to help people and make a difference. So we're not marking up our prices like a traditional healthcare company would. And then in addition, as I mentioned earlier, the health insurance companies have to cover things that 90%, 95% of the people will never use, but it runs up a bill for everybody else. And then, shall we say that some of the health insurance companies might have, perhaps layers and layers and 87 vice presidents, and we don't do any of that. We want to help people. And so the cost of the special cost at the discount that's been put together for the chamber is $17.95 for an employee. And then if you would like me to blow your mind a bit more, that actually includes the family for free. Now the family is not their aunts and uncles, but it is the employee, their spouse or significant other, and their dependent children up to the age of 26. Now that's for our entry program. And then our higher end program that includes the 10 to 50% savings on dental and chiropractic and hearing and vision, et cetera. That program is based on the special pricing we put together for Chandler Chamber. That's $22.50 per month for an individual employee, and it's $26.95 for an entire family. So we know we're leaving money on the table, but in a season where there's so much illness out there and so many people are afraid to go to see a doctor, it's a real privilege to have a program that can actually help people. So these are real pricing. There's no contracts. Your employers could go ahead and do it for a month and stop if they're not happy. We have to earn our stripes basically every single month.
Well, I love that. And that's why I wanted to make sure we repeated that. So many of our companies that we represent here at the Chandler Chamber are small businesses that are either sole proprietors or they may have just one or two employees. Can anybody just sign up for this program? Do I have to have a minimum amount of employees? How does that work?
That's a great question. When we were originally conceived, we thought that we were going to be a direct-to-consumer company. So we were set up to handle individuals. Most telemedicine companies, I assure you, do not want to do that. They just can't make enough money at it. They avoid small businesses like the plague, and it's deeply unfortunate because it causes problems for your employers, as we talked about, and it really hurts their employees. As a matter of fact, if one or two people at an employer comes down with COVID, they may have their entire business shut down. And while we can't guarantee nobody will get COVID, according to the government, Dr. Fauci, the president mentioned it this week, telemedicine is an ideal way for people to go ahead and see a doctor, so to speak, either by video chat or however they want to. They can dial in, and they don't have to leave the comfort and safety and protection of their own home to be able to do this. So there are no minimums. If it's a sole proprietor or they have 3 employees, that's fine. If they have 10,000 employees, we can help them. Obviously, the larger companies get special pricing, but we're set up to help really any of your employers, regardless of the size.
What if I have like 1099 employees that work for me, or that are they eligible?
Yeah, that's another thing that's a bit unique about our program, which is that even if I'm a large company and I already provide healthcare, what I don't provide is healthcare for my part-time employees, my gig economy employees, my 1099 employees, et cetera, because I can't afford to do that. But boy, I can afford $17.95 per month as a way of keeping those 1099s and part-timers happy. So yes, we're set up to do that. And even if an employer does not wish to pay for this program, they can offer it to their employees, and the employees can pay for it themselves. That's not the ideal way to do it, but we can help. And I should have mentioned earlier, because I know that this is important in your state, the telemedicine and the mental health services are available in both English and in Spanish. And in some markets, that's very important to know.
That's great information. Okay, I am super busy as a CEO here, and I hate government red tape. How much paperwork is involved from an employer's standpoint to set up this program?
I won't say it's zero, but it's pretty close. Unlike traditional health insurance, all we need from an employer is a simple spreadsheet with the information they already have. The employee's first name, their last name, their email, so we can email them a welcome package and a membership card that they can keep in their wallet, their purse. We don't ask their social security numbers, anything that's invasive at all. We don't need to know if they're a citizen. The only thing is we do ask their date of birth, because that's a way that we find somebody in our system. So they'll send us some very basic information. We do everything else. We know the employers are busy. The last thing they want is more paperwork. They also don't have to wait like traditional health insurance, the January 1st or whatever the normal start date would be, if an employer would like to start the process of helping to provide health coverage for their employees and to help protect their employees during this season of COVID-19, they can be up and running with us in a week if they want. Also, we make it very easy. There are certain industries that, despite everything, there's going to be turnover. So in a case like that, like retail or restaurant or maybe small manufacturing, or there's a host of industries that don't typically offer health insurance, they can easily go ahead. They just send us a simple email. Hey, Joan Smith is no longer with our company, but we have 3 new employees. So we make it very easy on a month-by-month basis for them to change out who they'd like us to actually cover. So very, very limited amount of work on behalf of the employer. We even help them with the sign up, give them red carpet treatment, if you will.
I love that. My gosh, Jeff, I am so excited about this program. I'm so excited to be able to offer that for our businesses, because it's all about keeping our businesses in business here in Chandler, as well as helping them grow, helping them give that member benefit. You have been so informational. Now I know that at the bottom of this, we are going to have how people can sign up, because we will have that on our webpage, as well as at the end of this program on how to sign up with the Capstone Health Network. And Jeff is available to answer any of your questions, even beforehand, before your company goes ahead and makes that program. So Jeff, thank you to you and your organization for identifying these needs and really being there for small business.
Terry, we are deeply grateful and excited to be working with the Chamber. We're a member of the Chamber now, and you do something for us that's so important. We have the program. It works like a dream. It can help both the employer and the employee at a very, very low price and keep people protected from COVID. But you have the connection to these small companies in particular who we can help. We don't. So we are very excited to be a member of the Chandler Chamber. And thank you for this opportunity, and we hope to hear from as many of the members as possible. We can answer questions for them. I know we're going to be doing some joint teleseminars coming up, or webinars, to provide information and make it very easy for the employers to get access during this particular season. So thanks to you and everybody at the Chamber. We're truly excited to be a part of all of this.
Well, this is exciting. So businesses, stay tuned. More to come with the Capstone Health Network. And thank you, Jeff, and your team for joining us.
It's our pleasure. Thank you so much, Terry.